for having us today. I have the difficult task after some brilliant speakers to try to focus on some of the aspects, focusing on nutrition, child nutrition. Dr. Paul, thank you very much for the masterclass on child malnutrition. I'll try to build on what you, but also many of the other speakers have mentioned. That means that I will not spend a lot of time on the details on some of the slides that can be shared later. I try to bring some of the points that some of you have also mentioned, try to bring that together. First of all, about half of the children are malnourished in one way or the other way. I'm not even including micronutrient malnutrition. I'll get to that in a moment. This is basically the same kind of information that also Dr. Paul mentioned. If you look at stunting, you really see stunting increasing in this 4, 6, 7, 8, 9 months. Very much because of the diet. The child is moving from breast milk to complementary feeding. But also, most importantly, the child starts moving around and is more exposed to parasites and then other illnesses. On the right-hand side, the wasting. And this actually, for me, is fascinating coming to India. If you take a wasting slide, wasting by age from many counts, like in Africa, it's got the same kind of curve as what you see on the left. Yeah, starting slow, and then from 4 months it goes up. Not in many counts in South Asia, definitely not in India. And you really see that a lot of the wasting is caused because of low birth weight. The problem happens in pregnancy, probably even pre-pregnancy. And I would expand, while we start talking more and more about maternal nutrition, I think you have to look beyond that, beyond the time that the woman gets pregnant. Again, the masterclass was given by Dr. Paul, so I will not go into further details. This slide I find quite relevant, zooming in some of the sub-data for stunting in this case. Would have been very similar for underweight or for wasting. First, urban, rural. What you would expect, yes, also urban malnutrition, yeah, but lower than a rural. Okay, we know that, but don't forget that actually when you look at the numbers, if it's about finding the numbers, the caseloads, we often ignore urban areas. If you would take, for instance, wasting in Maharashtra, about 50% of all children with wasting in Maharashtra are in about 6 urban areas. So if you go for prevalence, you definitely have to go to rural areas. If you want to go also for numbers, we should not forget the urban areas. And I think that's an area where collectively we've not given much attention to. We always tend to go to the rural areas. And on the right-hand side, I find it fascinating. Here we have 50% of the poorest children that are malnourished. But I want to turn it around. It also means that 50% of the poorest children are not malnourished. So poverty does not lead to malnutrition. There are other factors. And you all see that on the right. 80% of the richest kids are not stunted, but 20% are. So even while there's all the money to have good health care, to have good food, because of other factors, and I would put my money most likely because of poor feeding practices, which has got to do with what I would call nutrition literacy, understanding, appreciation of the importance of food and nutrition. Food is more than filling the stomach. Nutrition is more than filling the stomach. And I think that people don't understand it fully. Again, building on, we need to invest much more in nutrition literacy, in particular for the youngest kids. We haven't talked as much about anemia, very high, of course, already at the early age, but even we should not forget this poor age group, because kids, when they reach adolescents, particularly girls, they already start poor because we didn't correct anemia at an earlier age. Other micronutrient deficiencies, many kids have got at least one, and these are vitamin A, iron, zinc, several other micronutrients we looked at in the comprehensive nutrition survey. And you see that many kids have got various different and a number of micronutrient deficiencies. Also, children that are not stunted can still have micronutrient deficiencies. So we should not forget those kind of dynamics as well. You even see micronutrient deficiencies in children with overweight or obesity. Let's go to the response. An analysis published in The Lancet earlier this year, which I find fascinating, looking at 11 countries, 4 Indian states, and basically looking at the reduction in stunting. How was that caused? And we as nutritionists, we focus on nutrition and health interventions. But this study also shows that the importance of WASH, education, gender, poverty, it is at least 50% contributing to the stunting reduction that we saw in these 11 counties and 4 Indian states. And zooming on those 4 Indian states, and thanks to the IFPI colleagues for making this slide, you see very much the same. Malnutrition will not be solved by food and nutrition interventions alone. And probably less than 30% of the stunting reduction that we see in these states was because of health and nutrition interventions. We need to deal with early marriage and early pregnancies. We need to deal with poverty. We need to deal with socioeconomic situation. And then came COVID. I recognize 4 pathways, and some of you have already talked about at least 2 of them. The COVID infection, people get infected, and that leads, of course, to malnutrition, children get infected. In some cases, most cases, that's of a short duration. You might pick up again after that. There's, of course, the link between mothers being afraid to breastfeed in the context of COVID. A lot of talk about food systems, food security, and the impact on poverty. I would call it the second pathway. The third pathway, about that one, by the way, I don't think we fully appreciate the compounded impact of several waves. One wave, one shock, many families can deal with. Yeah, but if you've got a shock last year and a shock this year, and because they have these repeated shocks, then compounded with floods or droughts, dealing with compounded shocks, compounding of shocks, it's going to be very difficult for families to deal with. I don't think we fully appreciate that impact from COVID. Access to health and nutrition services, a lot of talk about that, and I'll show 1 or 2 slides on that. But to be really honest, for me, I'm most worried about the largest, but I think it's going to be the largest impact of COVID. It's governance, leadership, and funding. Poshan Abhiyan, for me, one of the most amazing programs and commitments of the Indian government that I've seen in any country. Why? Because it came with leadership and financing. And many programs, strategies, and policies on nutrition are lacking financing and are lacking leadership, but not Poshan Abhiyan. But let's be honest, Poshan Pakhwara, which was celebrated in March, was abruptly stopped last year, in the 3rd week of March, because of COVID. And since that time, Poshan Abhiyan hasn't received the same kind of leadership. I'm worried that because of finances, they might not receive the same kind of investment. Well, additional investing was required, and there seemed to be space for states and governments to do additional investments in nutrition. And I'm just worried, is nutrition still going to see that additional investment that was promised or that we anticipated? Or are all these funds needed to deal with the impact of COVID, to prevent COVID, to roll out of vaccination, but also to deal with the other social sector aspects? For me, I'm worried that this 4th pathway might be the most impactful and taking the longest. Yeah, and I think we have to look at scenarios. Best case scenario, we roll out the vaccination, and by the end of 22, next year, we're back to normal. But I'm worried about the 3rd scenario, where households are going to continue having this impact of the shocks of poverty. It's going to take them an extended time to replenish their resources that they spent. But also government, it's going to take time for government to have again the kind of leadership that we had in Poshan Abhiyan, where the Prime Minister frequently talked about nutrition, chief ministers were leading the response, the media was talking about nutrition, things were really happening. Let's look at some of the data, and there's limited data on the impact. There's some data on nutrition services uptake, a significant dip. And I've seen data beyond February this year. By the way, interesting to see how IFA for pregnant women. Interesting how IFA for pregnant women was increasing and this significant dip then in April. And again this year in April as well. The same thing with school-based interventions. Schools were closed. And for me, that has been a failure for us as nutrition people. We did not realize 18 months how much COVID was going to affect us and how. We've completely lost some of the platforms functioning, like for instance, some of the school-based health and nutrition interventions, like for instance, distribution of IFA. And this is a theoretical model. Where in the past, if you look at NFHS 3 and NFHS 4, we had a reduction of about 1% stunting per year. This is the blue line. Then the red line came because of Porsche and Abidjan. We were going to a target of 2% reduction per year of underweight and of stunting. And I think it was possible. If you asked me 2 years ago, I thought, yes, it's possible. But now the gray line. Yeah, and these four pathways, these worst case scenarios, I'm worried that malnutrition rates are going up. And it will take a long time to get indeed to that 1% reduction and even the 2% reduction that we were aiming for as we had hoped. So what is needed? 6 areas. We need to get this leadership that we had in Porsche and Abidjan. We need to get that leadership back. And we know from the Lancet studies, we know from the 4 state studies in India, reduction of stunting, direct relation with leadership, with the leaders pushing this, holding people accountable and collectively working. Universal coverage of the services, and that has not been the case anymore. Services have been affected. Adequate financing, and we need to relook at that and also make decisions, and even the previous one, if we can't do all the same interventions anymore because frontline workers are also involved with case tracing or with vaccination, what are we going to prioritize? We might have to reprioritize if there's less attention, but also less resources. How are we going to reprioritize the high impact interventions? We might not be able to do everything. The multi-sectoral response, data. At the moment, we don't have data even on malnutrition levels. And as UNICEF and partners, we reached out to state level governments, we reached out to several NGOs, even trying to get access to routine growth monitoring data, because if you have enough growth monitoring data, you could use that as a surveillance mechanism. If indeed COVID resulting in a reducing nutritional status. But getting the data is very difficult, and measuring the impact of COVID on nutrition situation and services is very challenging. And you already mentioned the multi-sectoral and the holistic systems response. But I think we need to re-strategize the nutrition response. It's not about building on what we had 2 years ago. No, we might have to accept that we might not have the same level of leadership, the same level of prioritization, and the same level of financing. So what do? Can we have scenarios, response scenarios for the best case scenarios? How do we respond in the best case scenario? But also this worst case scenario. How would the nutrition response have to look like? We know what works. We know how to reduce malnutrition. It's a comprehensive response, not just nutrition intervention. It's a multi-sectoral response. We know we need leadership. We know we need to address COVID. We know how it needs to be done. And now again, we need to go back to do we have the leadership at all levels, politically, but also academia, NGOs, civil society, and of course, community parents to actually stop malnutrition in India. I thank you very, very much.